All right, so welcome everyone to our office hours this afternoon. We're going to be focusing today on sections 6 and 7 of the IEP. Please feel free to drop questions as they come up in the chat box. We'll have a couple of spots where we'll stop and keep an eye on that. And if you prefer, you can always come off of mute and ask questions as well. Feel free to yell at me to slow down too if I get going too fast or anything else that comes up. So we're going to do some quick team introductions. We are going to talk about section 6, those supplementary aid services modifications and or supports. And then section 7, where you do your special education and related services. And then we'll go over any questions, and then we have a bunch of resources available for you. So this is our team. We are the supervision, monitoring, and support team. My name is Carly Thibodeau, and I have been with this team for about 2.5 years. And before that, I was a teacher for 21 years. And with me today is Ashley.
Hi, everybody. My name is Ashley Satry, and I joined the monitoring team about 1.5 years ago. And before that, I was a special education teacher here in Maine and in Virginia for 14 years.
Awesome. Thank you. And Julie is here with us today.
Hi, I'm Julie Pelletier. I have been with the monitoring team I'm in my 8th year now. And prior to that, I was admin support for a K-5 elementary school for 16 years.
Awesome. Thank you. This is our contact information. Our emails are listed here. So if you have any questions or need some feedback around anything, compliance, IEP, forms, information, feel free to reach out to us. We are here to support you. Okay, so we always like to start off with this visual of how the IEP aligns. Today we're going to be focusing on the supplementary aids, services, modifications, and or supports, and those services, the special education and related services part, so the end of the IEP kind of. But all of those pieces feed into these last couple of sections. So let's not forget about those other ones that come before. Okay, so we're going to jump right in. This is our section 6, what it would look like on the IEP. This is where you list those supplementary aids, services, modifications, and or supports. So I always like to stick the slide in there to just remind you that, everybody's different. So this section is very important for students in helping them achieve and show what they know, right? And make it fair and equitable to everybody. So when we think about this section, we really think most of the time, or I did when I was writing IEPs, this is really where you put those accommodations and modifications. And so just thinking about accommodations changes how a student accesses information. And there are some examples here, but kind of one that I always think of that helps me remember an accommodation is it doesn't change. Like, so maybe a student is reading a book. However, another student has access to that same book, but they're listening to it rather than reading it on their own, right? So that's would be an accommodation for a student. And then these are just some examples of accommodations. This is not an all-encompassing list. There are obviously way more than these and things outside of this. So just some ideas. And then when you think about those modifications are really are changes in what the student is expected to learn. So this is when you're changing things for the student. And some examples here are that if you change that instructional level or even the content that they're completing or participating in, things like that. And so one of the examples, kind of like the book to the reading for the accommodation, for this modification, it's really thinking about you're changing that content for the student. If you're allowing them to use like a calculator on the exam, then they're they have another way to access and show what they know with that content, or not even on an exam, just on any kind of work. So here is another list. These are just examples of modifications that may be appropriate for students. Again, this is not exhaustive. These are just some ideas. They were taken from a website that we don't necessarily endorse, but it was just a great resource. However, the link that I had for that takes you nowhere now, so I am not able to provide you with the link to where this went to, but I'm sure if you were to Google some ideas, things would pop up. Okay, so moving into kind of like what we look for as far as compliance with Section 6. When we are looking at this section, it's important to remember that if you fill something in on the left-hand side as an accommodation or modification, then that entire row is completed all the way across. So you have those check boxes, make sure at least one of those is checked off, whatever's appropriate for that accommodation or modification that's listed, then that location, frequency, and of course the duration. So that is something that we look at. One thing that is often included in Section 6 are accommodations or modifications allowed on the Maine through year assessment. And so this link will take you to the website for the Maine through year assessment, and there's a tab on that website around accessibility. And so they have an accessibility guide that they update, and the most up-to-date one is the 24-25. So if you have questions about whether it's already included or embedded within that assessment, it will tell you there. And if it isn't, and if you need to make sure it's listed in Section 6 on the IEP for the student to be able to access it, it will also explain that in that accessibility guide. So this is where you can find that. All right, in this section, we also want to think about, go back to Section 3 of the IEP, where it's that checklist of all the questions, yes, no, the special considerations. So if one of those special considerations is marked yes in Section 3, it may be appropriate that it's documented in Section 6 of the IEP. So some examples that we give are with 3B, they ask if the student has behavior and that they need positive behavioral interventions and supports or other strategies to address that behavior. So if that is a yes, it may be appropriate to put something in Section 6 to support that yes in Section 3. So in this example, there's a positive behavior support plan for this student. So that would relate to that 3B being checked yes, and that would support that yes. Now, it doesn't have to be a positive behavior support plan. It just could be an accommodation or modification that's in place that would show that the student has positive behavioral interventions and supports in place. So it does not need to be a specific behavior plan or anything like that. Then the other time where it would be appropriate to document something here, especially, is if the student, that CI is checked yes, that the student is a student that's an English learner or a multilingual learner, and they do have language needs. So they would be receiving services outside of the IEP through their ESOL or ELL department. So then they should or would have an individual language acquisition plan. My gosh, my words are not working today. Or ILAP, as we call it for short. So if they have that and they're receiving services because they're a multilingual learner, then you would want to document that they have that ILAP. You would put that in this Section 6. And then also, just to give you some more resources, we have the first link will take you to our website around multilingual learners with disabilities. And then there is a training that was done around the multilingual learner document. And that second link will take you to that. So if you have any questions about those. Okay, the next thing that we would see in section 6 possibly is that if you wrote a goal for a student, and in that goal you put certain accommodations, you listed them in there. Sometimes we see that you do not need to do that. However, many times we see that in the given statement. They'll say given specially designed instruction and access to blah blah blah, and whatever that is, you want to document in section 6 whatever that accommodation is, so that the student is able to access that throughout their school day, or whenever they need it. So whatever that frequency would be, but they would definitely need it for that goal, to work on that goal. So if they need it other times during the day, you would specify that in section 6. So you would list that here. Another thing that could be listed in section 6 is, are any of those assistants working with the student? So whether it's an ed tech, a BHP, a related service assistant, those individuals are not listed in section 7 because the position responsible is in section 7. And these folks are not the position responsible, but they are working with students or maybe working with students. So if you want to document them working with students, then you would list them here in section 6. Another thing that can go here in section 6 is if you have a collaboration that is happening. Now, collaboration is the word that we're using in place of consultation, because if it's a consultation, it goes in section 7, but it would need to have a goal. So if there's no goal and the teacher and the related service provider, or the teacher and the special education teacher want to talk to each other and just have periodic conversations and check-ins, then section 6 is where you would document that. And in the procedural manual, it says it would be best to call it a collaboration and not consultation, because it gets really confusing between section 6 and 7. So leave consultation off of this section, and that collaboration is a good word to use. So you can document that here. Right. Another part of section 6 is 6B. This is where the team discusses whether the student will participate in the alternate assessment. Okay, and so here's another just an information link. This will take you to that MSAA website. If you have questions about assessment, alternate assessment training, any of those things listed here are on their website. Then also, when you're completing this section, if you are considering the student for taking the alternate assessment, then if you check yes, it asks about using the participation decision flowchart. And this is that flowchart that you would be using to help determine whether the student would take that alternate assessment. So this is a snapshot of it, and the link will take you to this flowchart so you can access it. Now, when completing this section on the IEP, best practice is to check one of these boxes. Don't leave this blank, either yes, no, or NA. Compliance is that if you check yes, the student will take the alternate assessment, then you must provide that explanation. And it says it right under that yes. There's a little bullet that says if yes, include an explanation. You need to do that. And then the academic goals for that student need to have objectives. So here's an example of the team has decided that the student will take the alternate assessment. So they've checked yes, and then you can see in red they have included that explanation. So that would be compliant for that piece. And then we would go to the academic goals and make sure that each academic goal has at least one short-term objective. So that is a requirement for that. Explanation, short-term objectives. And then this link will take you to those alternate academic achievement standards, which you'll link your goals to for those students that are taking the alternate assessment, because you need to have a citation to your academic goals or with your academic goals. So if the student is taking the alternate assessment, you would want to cite them or link them to these standards. However, there's a little snafu with this link here. It takes you to the page, but then when you click on the core content connectors, which are what they're technically called on the website, it's a dead link right now. And we know this, and we are working with our website people to try to get that fixed. But if you are looking for those core content connectors, my advice would be to reach out to the assessment team. Specifically, Michelle Ganglefinger is our contact with alternate assessment. So if you need access to those core content connectors and you don't have them like downloaded or whatever, please reach out to her. If you can't remember to reach out or who I said to reach out to, you can always reach out to one of us and we'll get you in contact with her. All right. Any questions so far?
Nothing in the chat yet.
Nope, nothing in chat. And Ashley has dropped a couple of times the PowerPoints in the chat. So thank you, Ashley, for putting those in there. Anybody want to come off of mute and ask a question? Wait time is really hard on a Zoom call. Just gonna say that. Feels weird.
We can always come back to if something pops up and somebody's like, oh, now I have a question.
Yes. Oh, can you drop the PowerPoint again, please? Yes, we can do that. Oh my God, sorry guys. Jeez, I'm crumb. Oof. Okay, so we're gonna move on. We're moving on to section 7. So this is section 7 of the IEP, where the special education and related services are listed for the student. Now, one thing about section 7 is that you want to remember that the child's needs drive the services and their frequencies, not the school or program schedule. And we just we put this out there because we sometimes see this. It is more common when we look at schools that have like block scheduling. Sometimes it's more common at the higher levels like middle school or high school because they have a certain block of time where they're doing that subject. And so they want to use that whole time. However, if the student's needs don't require them to be in the special ed setting for that entire block of time, then the service grid should reflect that. It should reflect what they need, not what the schedule is for the school. And we do know that this is kind of a scheduling thing at the school level, but just to keep it in mind. So it's kind of a hard example, but if you have these 2 study halls going on at the same time, so the student is leaving that gen ed study hall and going to special ed study hall to get their SDI in reading, they're only going, this is saying 30 minutes per week, right? So that should be the amount of time that they're leaving that study hall. The other amount of time they should be allowed to go back to their gen ed study hall. If the student has the choice to stay in that special ed study hall, that can be included in section 6 as an accommodation for them. to have that choice to stay or go back. But if the student's time is up and they're like, all right, I'm going to go back to my gen ed class, whether it's a study hall or it's a reading class or social studies or whatever it is, and you're like, no, you can't, then that would be restricting them from joining the gen ed setting. So just keep that in mind as you're really thinking about what the student needs for services and how that's being delivered and documented on the IEP. Another thing with section 7 is that when you're writing in those services, there are no services for social studies, science, health, any of those content areas. Those are not listed on the service grid. A student would not have a deficit in that area. The deficit areas are around reading, writing, math, listening, speaking. Those are your academic areas. So if they are having instruction around the social studies curriculum or science curriculum or any of those content areas, it's really being addressed through their deficits with either reading, writing, or math. Those are the services that are listed in section 7 because those are where those deficit areas are. They may be impacting those content areas, but the goals and the services are still around those main deficit areas. So when filling out section 7 for compliance, just remember that each column is a must fill. So kind of like section 6, if you put something in the left-hand column, like you have specially designed instruction, then it should be completed across the row. All of the boxes need to be filled in. And then I talked about this a little bit when I talked about section 6 around that position responsible, but the person listed here is going to be that certified special educator or licensed related service provider, because they're the ones responsible for the goals. Even if an ed tech is working with the student, the special ed teacher is still overseeing that work that the ed tech is doing with the student, and they're responsible for the student meeting the goal. Same with the assistants, if it's a related service assistant, the the speech and language pathologist or the occupational therapist, they're responsible for the goal and making sure that the student is making progress, even if an assistant may be working with the student. They're still the responsible person. The location, just making sure you're filling out special ed, gen ed, or both. And then the frequency can be whatever is understandable to the team, including the parent. So that all depends on how you choose to fill that out. And then just the duration dates, remember to match those to the IEP or whenever the service begins and ends. Typically it's with the duration of the IEP. The one exception is ESY. So if you have a student that has ESY, just remember to adjust those dates to those summer dates, because technically, if it goes for the duration of the IEP for the entire school year, they could ask for ESY during the longer winter break, February break, April break, those sorts of things. So when you change those dates to just the summer, that specifies that's the ESY that you're talking about. The little blue box just specifies when speech and language is a direct special education service versus a related service. So you would put speech and language on the top half of the service grid if the student is identified with a speech and language impairment, either by itself or part of a multiple, or if a child has been identified with autism and speech and language is the only service that they get. Any other time, it's a related service. Also, just to note when filling out section 7 and you're listing, typically this comes with, the SDI, the specially designed instruction. You want to identify in the service grid what that specially designed instruction is for. Is it for math, behavior, ELA, that sort of thing? It can be put together or it can be separated out. that is up to you how you document that, but it does need to be specified what they are receiving for specially designed instruction. So here you can see that in the specially designed instruction, this student is getting ELA and behavior support, and you can put them together like that. Especially behavior, typically students aren't pulled out specifically to work on behavior. It's embedded throughout their day, so it would make sense that it is with another service or an academic service. Now, a little thing we like to say is every service needs a goal and every goal needs a service. So I know we're not really talking about goals today, but this is about alignment. And when we are looking at IEPs and we're looking for compliance, we are making sure that goals in section 5 always have a service aligned to them. But best practice is that it goes the other way too. So if you have a service listed in section 7, it really should have a goal aligned to it. So here's an example of, we have a student with SDI for self-regulation skills and OT consult. And this one goal covers both of those because in the given statement, it has both services. So you can see given specially designed instruction and consult from an occupational therapist because they're working in conjunction on this same skill. So they're both working on this goal. So this one goal is aligned to these services and vice versa. Which brings us to that other little thing I started talking about in section 6 was around consultation, because consultation is where is listed on the service grid. There's a spot for it as a special education service. And if it's a related service, you would typically put it under whatever that service is that is a consult. Like OT here, you can see it says occupational therapy consult. So because there's no consultation box on that related service half, but if it's a related service consult, it should be under those related services. So if it is listed as consultation on the service grid, then there needs to be a goal aligned to it. If you're like, oh, I'm just checking in with the teacher, I'm not working on a goal with the student, I'm not working with the student, then it really would probably be best if it's in section 6 as that accommodation where you're doing that collaboration. If you put it in section 6, there is no goal. But if you have it listed as consultation, there needs to be a goal. I think I see a question in the chat box. Given consultation, does the student need to be present when you are meeting? Consultation is around the skill being carried over into the more or into the less restrictive setting. So I don't really know how to answer that because let me think about that for a minute. Because really you should be working with the student if it's consultation. They still have a goal that they're trying to meet. So when you are meeting around a consultation goal, it really should be with the student. So then, yes, they should be present is going to be my answer. You're welcome. Okay. So just a couple of notes. These were taken from the procedural manual because sometimes these things come up in section 7 around nursing services. So in that section 7, there's a specific spot for nursing services, and only a school nurse or a credentialed school nurse can be listed there. So if you have someone else besides a nurse, they would go under other, I think, and put as a school health services. um, and not under nursing services. So nursing is only for those registered or credentialed school nurses. Then another thing on the service grid that gets a little tricky sometimes is transportation. So that's always documented as a related service. And then sometimes transportation requires a goal. And that is basically if they're modifying the behavior, if that's why if they're getting that service because they're trying to modify the behavior so that they can not have specialized transportation anymore. But if it's just transporting for day to day from a program to another program or something like that, then that wouldn't require a goal. So it all depends on what the specialized transportation, what the reason is for that. Right. Any other questions? Okay. It's everybody's favorite time, quiz time. It's a short one today, I promise. Just a couple. Okay, so let's take a look at this. This is section 6, the supplementary aid services, modifications, and or sports. So take a look at this. Tell me why this is non-compliant. We would look at this and we would give a couple of notes around this is not compliant. We need you to fix this. Right. There are boxes not checked in that second column for that first thing. And then not all of the boxes are filled out correctly. The location and frequency are blank on that last one. Very good. So yes, blank, and the location and frequency are blank. Very good. You guys got them both. So just remember, if you start in that left-hand column, make sure it's filled out completely across the row. For some reason, we have seen that when people do the assessment accommodations, oftentimes the location and frequency gets left blank. And it was interesting because today I just had a question about when I fill out my assessment tab, and I think it's more of a vendor thing, because if you all are using vendors to complete your paperwork and you have like an accommodations tab and an assessment tab under accommodations, that was kind of the vibe I was getting. And so when you fill out assessment, it seems like maybe something isn't, like it's not prompting you to fill these in. So these come up as blank when it changes to this view. So I would just caution that when you're filling stuff out, look at the print preview view so you can kind of see, because we don't know what it looks like on your vendor end. Like when you're filling it in, we just see the printed version. Okay, we got one more. Here is section 7. Here's a service grid. Why is this non-compliant? If you've been to any of our other trainings, you've seen this before. Right, location, yep. And yes, you got the ed tech is the position responsible. There's one more. Did I miss it? I don't think anybody said it yet. There's one more. It's a tricky one. I was guilty of this whenever I wrote IEPs. I didn't check my dates for my ESY dates. They're for the whole time. So you just want to make sure you adjust those, but you got the other two. So great. So when you're filling out your service grid, just remember that position responsible is the certified teacher or related service provider. And then fill out each of those boxes across the row and adjust those ESY dates. We just have some resources to share. We like to wrap things up. We like to give you lots of resources. If you have electronic copies of this PowerPoint, like the ones that Ashley put in the chat, and you open them up, the titles do take you to these resources. So the title will take you to the procedural manual. Great for everything special ed forms. Maine Unified Special Ed Regulations, or MUSER, has all of the regulations. It's just not super user friendly, but it's there if you want to go through it. Our 24-25 IEP quick reference document. This is broken up by compliance and best practice for all parts of the IEP. It's on the IEP itself now, which we changed to this year. So it's a great resource. We have all of these other resources. The first one takes you to our PD calendar where you can sign up for all of our PD, just like today's, that's upcoming. And then we have the second link is where you can go for our recordings and the PowerPoints. So all of the PD that we do record it, and it will be uploaded here as soon as it's available. It takes us some time because Julie has to work her magic, do some editing and whatnot. Then it has to go through proper channels and all that and get up on the website. So it does take a little while, but we do put them up there. And then more of our resources, just like that IEP quick reference document, we have forms, all of the eligibility forms, plus the written notice is there. And then this is our PD schedule for this school year. You can see that many have already gone by. These are the links to the recordings and the slides for the ones that we do have up on the website so far. We have some that are coming soon. And then we have a few more. We'll be going till the end of May. So please join us for any of our other PD that's upcoming. And then this is our feedback and contact hour form. Ashley just dropped it in the chat. Thank you very much. So please fill this out. Give us some feedback around how we're doing with our PD. We do look at it. We try to adjust our PD as much as we possibly can. Based off of the feedback. I will also send you a contact hour if you put your email in. Today's training is, I think, what is it, 22625, and it says IEP sections 6 and 7. So if you just select that training, put your email, I'll send you a contact hour for participating today. This is where you can find us online, Maine DOE stuff. And then this is our contact information one more time because we really are here to support you. And like I said at the beginning, feel free to reach out to us, any one of us. We will get back to you as soon as we can. We can answer questions. We can give feedback. If you have a hypothetical, if you're writing goals, if you're filling in any sections of your IEP, you can ask us, is this compliant? How does this look? And we're happy to get back to you. Just do not send us any student information or put it on an IEP or a form. Just like copy and paste it and stick it in an email as like a hypothetical. And we are happy to give you feedback and answer questions about anything. Go back here. So before we let you get off to your afternoon, evening, any other questions?
One question in the chat, Carly, just about the recording of this. The recording doesn't get sent or does get sent?
The recording does not get sent. I send out copies of the PowerPoint along with the contact hour certificate. However, the recording will go to our website. And Julie, do you want to?
Yep, they can actually even email me for a request for one directly to them, and I will gladly send it out.
Oh my gosh, that's so nice. That's great. Thanks.
Well, sometimes it's just a little easier. The website is not always, well, you know. Sometimes it's just easier to ask for it.
Yeah, I was gonna say, you mean it doesn't have dead links all the time? Like can't get to things? No. Okay. Well, thank you everyone for joining us today and have a great evening.